Unemployment insurance. Unemployment benefit that replace a portion of the lost income can be provided to cover unpredictable and unmanageable events. Such losses can occur for many reasons. Most can be categorized into either temporary events that affect small group of people or permanent technological or demographic changes, which may be a significant impact on the employment rate of company. The formers are insurable, but companies are naturally reluctant to offer much cover for the latter, and because it is difficult to distinguish between the two in practice, very little unemployment insurance is offered by the private sector. Unemployment insurance bears many similarities to disability insurance, not least because it is those who are least fit who are most at risk of retrenchment. Find new employment is difficult and even traumatic, especially when there is a shortage of position. The same balance is needed as in managing disability claims. In practice, most country social security system provide a basic level of unemployment insurance, and private insurance is often limited to a component of credit insurance, i.e. insurance sold by banks to cover the repayment on loans. Medical cost insurance. Medical cover comes in a variety of forms and is normally intended to supplement whatever medical services are provided by the state. It is often used in travel, as foreign visitors are often not entitled to care in state hospital. Hospital cash. This is the simplest form of medical cover. Hospital cash, paying a fixed amount for each day the insured spends in hospital. These contracts fulfill a need to the extent that the more significant medical costs are related to stay in hospital. They may be less relevant in light of the modern medical practice of returning people to their homes as soon as possible after hospital treatment. Medical insurance. This cover is of indemnity to the life insured for the medical expenses incurred by his immediate family. The cover may be for all medicines, consultations, procedures, and hospital visits. There may be maximum annual limits to the overall claims, or claims in each category. There may also be deductibles, also known as excesses, where a fixed amount or proportion of each item must be paid by the insured. These obviously protect the insurer, as the deductibles reduce the moral hazard. Health Maintenance Organization (HMOs). These are mainly U.S. development, and are a response to rising medical costs and the problems of third-party payment. The parties are the patient, the healthcare professional and the insurer. Where the medical expenses are fully covered, there is no incentive for the first two parties to reduce costs, particularly if this will impair the quality of care. In HMOs, the healthcare professionals are paid a capitation amount for each person covered. Their incentive is to keep people healthy so that they do not have to be treated. This may, however, lead to experimentation with cheaper forms of care, which may cause insecurity on the part of members. There have been successes in containing costs, but HMOs are not a panacea. Critical illness insurance. These are not indemnity contract but pay out a predetermined amount in the event of the diagnosis or treatment of one of a number of conditions listed in a contract. These lists were relatively short when these contracts were introduced in the mid-1980s, but have increased to hundreds of conditions in some cases. These policies are less expensive to administer than more comprehensive medical cover, as they only pay for larger costs. These contracts could replace medical insurance, but usually not permitted by legislation that requires a version of indemnity cover. In such cases, the justification for these policies has to be that the conditions covered can have a debilitating effect on the ability to earn income and may give rise to significant expenses not directly related to treating the condition. The policies can provide funds for rehabilitation or enable the insured to modify his future lifestyle and compensation for the unpleasantness of a major illness. Long-term care insurance. This cover the cost of assistance with the needs of everyday living, which is a need mainly of the frail-aged. Frailty is usually determined by reference to the ability to perform certain activities for daily living. The cover is expensive and not easy to contemplate at a young age. In the U.S., the Life Insurer Fact Book 2008 reports that, while most purchasers are over 65, the trend is toward young purchasers, especially the 12% of the workforce not covered by employer-based insurance. It also reports that policies are now designed to cover services that promote independent living in addition to institutional care. It may be appropriate or efficient for care to be provided in an aged care institution, at a cost. It is widely accepted that it is desirable for people to remain outside formal institutions for as long as possible, but increasing numbers will inevitably require admittance.